Well, everybody, welcome. Week 20 of the Precious Metals and Preparedness class. This is your host with the most, Pastor Keith, Brother Keith, your good buddy. And I have some guests today. I have some guests that I have known for some years. I used to do some preparedness shows with them, and they are the creme de la creme when it comes to preparedness. They're not people who are actors, they're not fakers, they are the real thing. They're really are medical professionals. I've been hanging out with my good friend Donald Trump, so I'm going to start emphasizing words. They really are medical professionals, and they're really good. These I want to read a little on their bio just so I can give you guys some of the background on who these lovely people are. Okay. Joe Alton, MD, is a retired but actively licensed MD and fellow of the American College of Surgeons and life fellow of the American College of OB/GYN. Amy Alton is a nurse practitioner and certified nurse midwife. And let me say that properly. Amy Alton, APRN, is a nurse practitioner and certified nurse midwife. Together, they're the authors of three-time Book Excellence Award first place winners and Amazon bestsellers in survival skills and safety/first aid, the Survival Medicine Handbook, plus the 2020 Excellence Award first place winner, Alton's Antibiotics, Infectious Disease, the Layman's Guide to Available Antibacterials in Austere Settings. They are also the award-winning authors of the Amazon bestseller, Alton's Pandemic Preparedness Guide, the 2014 New York Times bestseller, The Ebola Survival Handbook, the Zika Virus Handbook, and others. They are well-known speakers, podcasters, and YouTubers, as well as contributors to several leading survival homesteading magazines like American Survival Guide, Survivor's Edge, Off-Grid Recoil, Prepper Survival Guide, and Backwoods Home. Dr. Alton and his works have also appeared in the New York Times, Fox News, Newsmax, HLN, Newsweek, New York Magazine, and many other TV, radio/print outlets. Together, the Altons have donated hundreds of thousands of dollars from book royalties to put together medical kits and keep medical supply prices affordable for families everywhere. Ladies and gentlemen, I am introducing to you the Altons. I like to call them, as the world calls them, Dr. Bones and Nurse Amy. Welcome.
Hi,
Hey,
Keith.
hi, Brother Keith. Wow, who are those people?
I know, right?
They don't sound like us. It's a little bit too much.
Well, we've been doing this for a lot of years, so I guess
Yeah.
it accumulates over time.
Yeah, it's true. It's true.
Oh, he's also been on Fox News weather recently. They've been
Yep.
using him when they have, some cold front or hurricane or something's on the way.
Heat waves.
He's actually been on Fox News.
Yeah.
Fox
Wow.
News.
Fox weather.
Yeah.
Okay. Well, I didn't know that. So we're
Yeah.
going to add meteorologist to the title?
I'm just here for the beer, as they say.
Oh, okay, cool. Well, I'm so happy to have you guys here. This is going to be in my Patreon group as well as YouTube. So people around the world who don't know you are going to get to know you. And hopefully they're going to support you because you guys are doing really good things. I remember just meeting you guys at a few different preparedness events since going back to 2012. You're no stranger to this stuff, so that's why I know I can bring you on this show and trust whatever you say because you guys know your stuff.
Thank
And
you.
I remember when you guys started out, and I was just one of the people in the crowd, and of course I had my own little book stand, so we couldn't really talk like we wanted to, but I'm glad that I was able to stay in touch, and you guys are still just doing it, man. I'm like, wow, look at them. They're awesome.
And we appreciate your outreach and everything that you do for the preparedness community too.
Absolutely.
Well, thank you so much. Now I got a couple of questions. Actually, I got a bunch.
Okay. Fox,
But-
shoot.
But this is
Will.
for my Patreon class. This is for them, but as well as some of the people out there in the YouTube community. We all watch disaster and survival movies,
Yeah.
and we always have those questions, like, well, what could happen? Is that likely? Could that even happen? So I'm just curious on you guys' thoughts, because we're gonna definitely get into medical stuff, and but I'm just curious. What do you think is like a likely situation that we can have in the United States, and then like the hospitals are like overcrowded or shut down? Like, what do you think like can lead to that? Like, I mean, we got solar flares, EMPs, civil unrest, aka civil war, war with Russia potentially, or China. I mean, the list goes on and on.
Right.
So what do you guys think? Like, what makes you say, that is very, very possible?
Well, I think that what we've gone through just recently with the COVID pandemic, I mean, it was just one clue as to what happens when you have a disease that causes a 1% death rate. What that does to the hospitals, causes them to be so overcrowded. I have, many physician friends that are actively practicing in hospitals. A lot of hospitalists, doctors are only in hospitals, ER doctors, things like that. And I'm telling you, I've never seen people so tired in my life with a disease that caused 1% death rate.
Right.
If we found a disease that caused a 10% death rate, then I'm telling you that what that's going to do, 10% death rate means probably a 30% death rate among medical professionals, because they're going
to be exposed to it.
They're going to be exposed to it a lot more.
Wow.
When I was in the emergency room treating patients that came from Cuba during the Mariel boat lift, that was way back
early
in
80s.
1980.
Right.
I actually, I treated so many sick, very sick people that I wound up getting tuberculosis. And so even today, I test positive for tuberculosis, and I have signs in my chest rate of tuberculosis.
Whoa. So, because you just blew my mind with that. So even though you had TB years ago, how many years ago?
Oh yeah, but when you do the
40.
test, the skin test, it still comes up positive.
The skin test still comes up
It'll
positive.
still,
And I have a little
it's got a little
walled off
like scar tissue area.
Right.
Yeah.
In
It
one,
won't do
one lung.
anything, but
Doesn't do anything bad.
It's
but
walled off.
yeah,
but it shows up on chest x-rays.
I took the treatment, and I had to actually take 3 different antibiotics for 6 months to get rid of it.
So the whole thing is that, what we're saying is that if there is a pandemic that actually has a higher death rate, the medical professionals who we really need to stay the healthiest are going to be the most
sickest.
Exposed, and therefore be the sickest, and probably have a much higher death rate than, say, you at home and, isolated yourself, versus having to go to the hospital every single day for 8-12 hours
and one
shifts.
Right.
I mean, you can use all of the biohazard, head to toe covering, but even in Africa, when Ebola was going through, there were medical professionals who were getting it. I mean, people got sick. It was rare, but it happened. There's that little bit that you took your gloves off wrong, or you touched something you weren't supposed to touch. Just because you were in a hurry and didn't realize it. So these people are going to be exposed, no matter how careful they are. They're going to be the ones that may, unfortunately, bear the biggest brunt of the death rate.
And not only that, I mean, we're just talking about one possible scenario. I mean, you mentioned an EMP,
right?
If there was an EMP, if somebody, let's say China decides to explode a nuclear weapon, satellite delivered 200 miles above Chicago, let's say, that's going to basically take out the infrastructure probably for 1,000 miles each, all the way around,
direction,
in every direction.
Right.
And I can't think of a type of medical calamity that we won't have if that kind of stuff happens. I mean, massive, take society to the brink kinds of events, things that you can expect to happen would affect everybody. I mean, water treatment plants wouldn't work. That means that you can get an infection pretty much anytime you drink something. Yeah. Food preparation is going to be problematic. You're going to see outbreaks of dysentery, cholera, other diseases take their toll, especially as the IV supplies, to keep people hydrated, right, that are suffering from these things, which cause you to have massive diarrhea, for example, are quickly exhausted, right, and people die just from being dehydrated.
And guess where we get all of our medical supplies from?
Yeah.
China.
Right. Exactly.
Right.
Right.
all of our medicines, all of our medical supplies, there's literally a handful of medical supplies that are not made in China.
Right, it's true. And
I mean, that's
Is
it.
that, and let me ask you, is that mainly just because of cost? It's just cheaper to get
Yes.
those supplies there?
Yes, because
Absolutely.
companies left America and went to China.
because it was a lot cheaper to do that. I mean, we want people to have, you know, a good living wage, but, you know, unfortunately, not every country, China especially, doesn't really care if there's
Right.
a living wage. They just want,
And they also don't care how old the people are who are working either.
right, that's true.
It's sad.
So-
So yeah, for financial reasons, all of our medicines pretty much and all of our medical supplies come from China. So if they cut us off, it's not far down the road that we don't have anything. We don't have gloves, we don't have masks, we don't have IV fluids, we don't have any medicines to take care of anything, not even Tylenol.
In the end, we're not even going to have power, you know, to keep machines going that actually
This sounds so terrible.
keep people alive. I mean, you know, we'll have.
Okay,
I mean,
hold on.
we're
Hold on.
supposed-
Nurse Amy just said something, and I want to make the viewers laugh. Okay, guys, remember this is a class. We're just teaching the class, and yes, I have to laugh to keep the mood up. And yes, some of it does sound terrible, but remember, this class is dealing in reality.
Yeah.
So, and a lot of the people who watch my channel, they know that I always tap back into the spiritual side of prayer, and you know, we believe in miracles and everything. But I'm very balanced. I'm like, look, you know, before you say I'm going to rebuke that bacteria in Jesus' name, let's make sure we know the name of that bacteria.
We understand, right?
After we use the antibiotics.
And I know, and it's true that, you know, this sounds all very alarmist, but the truth of the matter is that you can take care of 90% of the things that might happen medically to the people in your family if you have some knowledge, if you have some supplies. And that is our role, to take that person, that average person that has become the highest medical asset, not by their own choice, but because there was nobody left, the highest medical asset left to their family. And our job is to make them effective in that role, to let them know what they need to have, how to use it. And that's what we have dedicated really our lives to, you know, since, well, probably more than 15 years now.
I also want to explain the name Doom and Bloom, because if you're like, what, Doom and Bloom? The .net is our website, but Doom and Bloom is our company. The doom is basically what we're talking about. You know, the what ifs.
Disasters.
Could this happen locally, regionally, my country, the world? And then the bloom is that you thought about it. You watched a YouTube video, you watched a Patreon video, and you woke up and you said, okay, I need to get some stuff. I need to get some skills. I need to get some equipment. I need to get some food storage, you know, do your checklist. And that's the bloom, because now you can do something about it. It's more in your control.
The bloom is the human resilience in the face of adversity.
That's right.
So, oh man, we got so much we could cover. So this just popped in my head, and we're gonna be going all over the place. But okay, shelf life. I know we've studied, we looked at stuff online about shelf life for both antibiotics as well as just store-bought medicines, the Tylenols and Advil. What do you guys think, just on, because we're trying to get people to start preparing and having this stuff in their homes.
Right.
What do you guys think is like, how much longer can shelf life go for the basics like Tylenol, Advil, cough syrup? Can those go longer?
Well, this is the deal. The reason that we know, first off, expiration dates are an arbitrary fake number that have been basically, really, what is an expiration date? An expiration date is the last day that the pharmaceutical company will certify that their product is 100% potent.
Right.
Now, that doesn't mean that it's not potent the day after, and it's or the year after,
or 5 years later.
5 years after necessarily. I'm going to tell you why I believe that, and why what I'm saying is true. And it doesn't mean that you're going to grow a horn in the middle of your forehead if you take it. You know, if you take an expired drug. Now,
right, they don't become toxic. That's, I just want to be clear about that. Expired drugs do not turn to poison. So if you went into your grandma or your great grandma's medicine cabinet and you just took a Tylenol and then you looked at the date and it expired in 1975, it is not going to hurt you. It may not work at all because 1975 is a long time ago, but look, maybe it has 5% potency left or 10% potency, but you're not going to get the full effectiveness. But what you're not going to do is have to induce vomiting
because you're poisoned
take the
yourself.
person to an emergency room. So
Okay.
expired drugs don't turn toxic.
But wait.
I want to just be sure that people understand that, you know, that it's all about losing potency, not killing you.
Let me tell you why I know this. Let me tell you why I know this, Brother Keith. Because we have a Department of Defense, and the Department of Defense has stockpiled at least over 100 drugs that are useful in peacetime or military emergencies. And we call that the National Medical Strategic Stockpile. And we have tens of millions of drugs, doses of drugs, different types of drugs. Remember, you may have heard that we had face masks stored away. We had about 43 million face masks. I mean, with the COVID epidemic, that wasn't enough. But we have these massive quantities of these materials,
Right.
including the drugs. Now, in the past, the Department of Defense would get out the forklifts when an expiration date arrived and throw away $500 million worth of antibiotics,
Medicine,
let's say, right? Things like that.
Stockpile
Well, even they decided that that might be a little wasteful. And so what they did is they did a study, and the study is known as the Shelf Life Extension Program, and it continues today. And what they found is out of the 122 drugs that were used in peacetime emergencies, that every drug that was, or almost every drug that was in pill or capsule form, was 100% potent between 2 and 12 years beyond its expiration date. And
Wow,
the reason why, and the reason why the one that was 2 years, the ones that were 2 years, is because they were only expired 2 years at the time they were tested.
Right.
On top of that, in San Diego, there was a pharmacy that actually broke down a wall and found a secret, not a secret, but a forgotten area, storage area.
Right.
And they found drugs that were 28 years expired. And of those, 14 out of the 16 drugs that were in that storage area were also 100% potent. Matter of fact, some were 110% potent because the other ingredients in the drug had degraded, but not the active ingredient.
Right.
So these are things that people really don't know, that these expiration dates, they tell you to get rid of these things.
Yes.
But many times, if there is a problem, then the government will issue an emergency use authorization for you to use expired drugs. And they did that when the military did a huge buy of the antibiotic called doxycycline.
Really?
About 10 years ago. And so what they did is they actually wiped out the market. And so what they did is they did an emergency use authorization saying that you can use these drugs even if they're 5 years expired. And I think up to 10 years expired.
Mm-hmm.
And so this is something that is a real thing. The Shelf Life Extension Program continues today. They do it for antivirals, they do it for antibiotics, everything that's in pill or capsule form. Now, the things that were not in pill or capsule form, insulin, amoxicillin elixir for kids, for example.
Now we're talking liquid stuff.
Right, liquid stuff, a Robitussin cough syrup, for example, that actually does lose potency pretty soon after its expiration date. Not the day after, but I probably wouldn't keep it a year after, because it will lose its potency. That doesn't mean it goes poisonous or anything like that, but you won't get as much use out of it. With EpiPens, they did a study on EpiPens, 3 years expired, still up to 80% effective. So you might need to use 2 EpiPens in the case of anaphylactic shock.
Somebody's really
but
having
even
problems.
the company itself tells you to use the expired EpiPens if you don't have fresh ones.
Yep.
Wow, that's good to know. This is awesome information, because a lot of times, you know, I'll get into arguments with people. They're like, "Oh no, it's expired. You got to throw it away." And sometimes I'll go to a relative's house if I needed something, and they're like, "Oh no, it's expired. You got to throw that out." And even just recently, I needed some antibiotics, and my uncle had some in his in his cabinet that was 5 years old, and I used those antibiotics and they worked just fine.
Yep,
So,
that's right.
I know. I mean, you don't want to tell people. I mean, if you have today's medical system, we're not saying, everyone just use all your old stuff. No, if you can get to the doctor, if you can have a pharmacy that's open and you can get some fresh stuff, please do. Our discussion with Brother Keith today is in times where that is not existing, then we may have to do it. And from what we've seen, they work fine. And like you, we have used some older antibiotics, not necessarily because we couldn't get fresh stuff, but I'm like, you know what? Let me use this really old stuff. And like you said, see if it works. And it did. So
well, let me
it's
say the
pretty
disclaimer.
interesting.
Nurse Amy, I'm going to say the disclaimer really quick.
Okay.
This
Good.
show is just for entertainment purposes. You are to seek a doctor or a medical professional at your own discretion and your own convenience. The opinions on this show do not necessarily reflect any medical journal that you're reading at the current moment. We are just stating opinions, even though there may be some facts. You are to still seek out a medical professional on your own. We are not liable for anything that you may do in your personal life. Thank you. So I just had to put that out there. Just
Well said.
I really appreciate it. There are just some people who watch these videos and they're like, oh, that's wrong. And you shouldn't do that. And they're right. We shouldn't do that now. But our discussion is purely, this event happens. We don't have a choice. What can you do to keep you and your family safe and healthy? So
thank you. This is exactly the discussion because, a lot of our viewers, a lot of people on Patreon class, we see these movies, these disaster movies, different scenarios and things like that. And we're sitting there with the what ifs. And it's like, well, we're giving some answers for the what ifs. If there's the thing called rule of law, if rule of law does not exist for like 6 months in this country and the hospitals are either overcrowded or closed, you need to have an idea of what you're going to do. At least have an idea or a thought process. Are you going to be the dummy to say, oh, this antibiotic is expired by 1 year, I'm going to throw it away? No, that might be a barter item. Maybe you can trade it if you're not going to use it. Right. I mean, just use your brain. The aspirin is 2 years old. We can't give that out. Oh, yes, you can. You can still use it. So that's why we have to have these discussions to let people know, you got to do this thing called basic personal responsibility, which a lot of people don't like to hear in this day and age, but personal responsibility. Let me ask you guys another question. What basic medical supplies and medicines do you think every household should have? Just on the basics. We know not everybody's a doctor or a nurse or a professional, but still disaster situations and regular emergencies do pop up.
Well, you know that everybody has adhesive Band-Aids and for minor cuts and scrapes, and probably some Advil, Tylenol in the medicine cabinet. But there's always a risk for things that are worse than that can happen. You may have a traumatic fall or something like that. So I'd suggest supplies that would deal with things like bleeding wounds, bandages, tourniquets, some blood clotting gauze. These things are widely available. You can find them anywhere, and we have reviewed them in numerous free articles on our website.
And also with the bandages, both sterile and non-sterile, because non-sterile is much cheaper for you to accumulate, and you can use that to help stop wounds. 80 to 90% of bleeding, if you put enough pressure on it with that non-sterile gauze, you can stop the bleeding. It's the other 15-20% that needs something further. So non-sterile gauze is cheaper, and it can be used to help stop bleeding and also to clean up wounds. But you want to get sterile gauze because after you've cleaned the wound thoroughly, you want to leave the sterile gauze on intact with the open wound so that you don't introduce any more bacteria. So you need sterile and non-sterile.
Of course, there are orthopedic injuries, so sprains, strains, things like that. You want splints, you want ACE wraps, cold packs, heat packs. Use the cold packs in the first 48 hours. Use the heat packs after that.
Also you can buy water bottle and the cold water bottles bags. They're blue with the little screw top. Those are good. And also hot water bottles.
As well.
Because if you don't have any of the, shake and break, instant heat or ice packs, or you've run out of them, if you have an ability to heat water, or, maybe you have a cold pond or something, you can get some cold water. You can at least apply cold and heat with those water bottles, the old fashioned ones.
Right. Also, let's see, antiseptics, a variety of over-the-counter medications, antibiotics, as we've been talking about that, to deal with infection and inflammation, and gosh, much more. We have a big giant list of what you should have, exactly what you should have on hand for a family, for a community,
right,
for a field hospital. We have them all listed in our book, The Survival Medicine Handbook, in the 4th edition, which is subtitled The Essential Guide for When Help is Not on the Way. And on our website, you probably find a number of articles on it at doomandbloom.net. So if you want to know exactly what to have, we've got it listed. I think we have
check boxes,
little boxes to check
on all the pages of the medical supplies. So you can say, got it, need it,
got it, need it,
got it, need it. We talk about eye care specifics. We have a whole list of natural remedies. If you're into that and you want to learn how to, use natural remedies, what equipment you should purchase. There's sections there about what you should grow. And then there's other sections about how you use natural medicine. So the book really integrates modern medicine with herbal medicine. As much as we can give little suggestions throughout the book, let's say we're talking about headaches, I discuss peppermint oil on the temples and, ice packs on the neck. And so we try to integrate some natural stuff, through the book. It's not an all end herbal book, but we want people to understand that if we can't get antibiotics, if we can't get, antiseptics, what out in nature might help us.
Might be in your own backyard.
It may not be equal to, but it may help you get through or solve the problem that you're having.
Yeah, no, that's real. That's what people need to know, because I mean, I'm one of those people, like if it's an emergency and if it's something I can use, I'm gonna definitely try it. And even when when I was living in the mountains of North Carolina, which I will be getting a second home there again, I used to go out. I refused to buy mint when I had digestive problems to have mint tea. I would go right out in the woods, grab some mint.
There you go.
Boil up my mint, have my mint tea. And I was like, why am I buying it? It's right here in nature.
Well done, sir.
Yeah. That's
so
awesome.
we need people to think like that, whatever they can use if it's available. But you guys have so much information. Let me ask you a quick question. On this topic of antibiotics, through my prepper experience, I heard and I know that there are some antibiotics that you could use from like either a fish store or animal supply store, and I'm hearing that it's that somehow the FDA is up to something, trying to like cut that supply. Do you know more about that?
Well, that's a very timely question. It really underscores the challenges that the family medic has in times of trouble. In 2010, I was the first actively licensed physician to write about fish antibiotics. I had seen the History Channel program. I mentioned that After Armageddon was a History Channel presentation where a paramedic and his family try to survive a post-apocalyptic landscape. And in the show, the paramedic gets a minor injury, which he soon recognizes has become infected. No one, however, even the medic for the community that they're in, has antibiotics in their storage. And so this trained professional can only just sit there and watch himself get worse day by day until he finally dies a few weeks later. And so, realizing the gravity of this, I mean, I look for ways that a family medic could obtain the supplies necessary to avoid some preventable deaths, like what happened to that poor paramedic. We were involved in the aquarium hobby. We also have a pet parrot. And so I knew about some antibiotics available for fish and birds that were without a prescription. So I decided to check these out in depth. I found about a dozen that were identical to those used in humans. These few were really unusual in that, although they were meant to give your guppy or your parakeet, they were the same dose as they only came, as a matter of fact, in the same dose that you would give an adult male human. And
or the child's dose.
or
the child's
or
dose.
a pediatric
Yep,
dose.
yep.
So they came in
Just
two
those two.
doses usually,
Yeah.
but the doses were exactly either a human pediatric dose or a human adult dose.
Yep.
And so we researched it further, and we took a look at to take an example, we took a look at some fish mox, which was a amoxicillin for fish and amoxicillin for humans. And we opened up both of these bottles, and in each bottle was a capsule that was pink and red, and had the numbers and letters W731 on it.
Yep.
So the human antibiotic had the numbers and letters 731 on it, the same colors. The fish antibiotic had the same colors and then the same numbers and letters. They were identical. And so we actually went into the industry, and we found out that they were actually the same as the human version, produced in the same batch, just redistributed, rebottled in different containers for the pet, fish, and bird hobby.
Yeah, they just put them in another bottle and slapped a label on it for the fish. And then some of those went to the pharmacy.
So I wrote articles, and you'll find probably 20 or 30 of them, and a book called Alton's Antibiotics and Infectious Disease, telling people to be sure to get a supply for survival scenarios. Because so many prepared families now have a supply of antibiotics in their storage. But as you said, Brother Keith, on December 14th, the U.S. Food and Drug Administration issued 9 warning letters to manufacturers and distributors of what they call unapproved antimicrobial animal drugs for violations of federal law. And they included companies like Chewy.com, Valley Vet, Kraft Drug, and others. The animal
Midland Vet.
And the animal products referenced in the warning were the exact ones that I talk about, labeled for aquarium fish and pet birds. Now, that may not sound like a big deal to the average person, and in normal times when you can get antibiotics from your doctor, I guess it may not be, but if you're concerned about a situation one day that may occur in which you're no longer making this stuff and it's no longer available to have it,
or being shipped from China.
The lack of antibiotics, the lack of antibiotics would be little consolation to, let's say, a sick child, a parent who had a sick child, a woman with a bacterial infection after having a baby,
a tooth abscess. It doesn't take much. I think a football player just died like a couple months ago from a
tooth abscess.
An NFL
I forget
player.
who that was.
Ex-NFL player. In today's age.
So the FDA actually says that if you currently are in possession of fish antibiotics, you should dispose of them. And that's up to you. But in normal times when antibiotics are easily available, sure, that may be a reasonable thing to do for some people, but not for me. And in a true long-term major disaster, it would be useful to have some in your storage. That's all I'm saying. I'm not telling you to take it in normal times necessarily.
No, we already had our disclaimer, honey.
We had our disclaimer there. But do you want to know something? You may save a life that might have been lost unnecessarily in a true survival situation if you have some of these on hand. You may actually still find some online if you Google fish antibiotics. But I'm telling you, it's not going to be out. It's not going to be for long.
Stopped. I don't know if anyone has it. You'd have to look. But literally days ago, people ran out because they stopped selling them, or they stopped making them. So whoever was selling them just sold until they ran out.
Okay, right. Well, this is when I give that prepper tip, because that's what I do in my Patreon class. And the prepper tip. Okay, guys, you heard what they just said. Now, if you can't find the fish antibiotics or the equivalent, if you're having trouble finding it, go online, start searching other countries that will ship to the United States. And there's another tip. If you go outside of the United States, i.e., like I just went to Bahamas the other day, if you go to Bahamas or Jamaica or Dominican Republic, like
Mexico,
I went down there the other day, Mexico,
India, right.
Guys, these countries sell these medicines and antibiotics over the counter.
Over the counter, which is what we should be doing.
Hello. So I'm just giving you guys a heads up. If you have a friend or a relative that's going to any of these places for a vacation or a quick cruise, give them a few dollars. Say, hey, grab me a bottle of penicillin or amoxicillin, whatever you need. and they're going to literally spend a few bucks because it's even cheaper in some of these countries
Right.
and bring it right back.
Right. Yeah, we were in Spain, and I got deathly ill. Deathly. I mean, it was the night before we are getting on a plane. I mean, it's literally the sickest I've ever been in my life. And we had to go home. The Iceland volcano had gone off. We were stuck in Europe for days and days and days just trying to get out. Made our way to Spain. It was like the only plane, the only tickets, our last chance to leave. And I get this horrible pneumonia. I mean, this was back in 2013. Was it Iceland volcano? 2010. Anyway, he goes down to a pharmacy, leaves me in the hotel room. They gave him everything he needed. He just told them what he wanted, and they just handed it to him. It didn't matter if he was a doctor. They said, "Yo, you're sick here in the shelf and there." So there's a lot of countries that, you know, give the responsibility of your health to the individuals instead of the government being our nannies. They say, you know, if you're sick, and you go to a pharmacy or a store and you buy what you need because you're sick, and then you take it home. They don't watch over you. So anyway, there are lots of countries that allow the individuals to have responsibility.
I'm trying to stay on track because I'm about to, child, let me tell you. When
Did I open a can of worms?
I'm telling you, my wife had COVID and went to the hospital because my wife could not drink. Anytime she would drink anything, it would just come up.
Oh.
She couldn't help it. And so it was 5 days that she went by, she couldn't drink. So went to the hospital, and of course, they gave her an IV, and she literally, after the IV, she recovered. COVID went away. So, but saying that to say this, I remember one particular nurse verbally assaulted my wife for not taking the vaccine, that it was my wife's fault that she's sick because she didn't take the vaccine. And my wife was too weak to even argue with her or fight. And I thank God I wasn't there when it happened. And then when I came in later, another nurse came to relieve my wife, who was of Caribbean descent. And so we established a friendship. And she told me, she said, you know, you could complain to get her fired if you want. She said that lady has no nerve saying that to you guys. And number two, she says, she told me half the staff in the hospital had COVID. Right. She said we're all vaccinated and half of us had COVID. So it doesn't make a difference on who's got it or not. She says people are coming to the hospital and getting infected for what you had said earlier.
Yep.
So it was kind of comical, but I believe in that. I believe that every patient should have the choice on what they want to do, what's the best mode of treatment for them, whether we're talking about medicine, vaccine, whatever.
Exactly.
Let them have their choice.
Yes, absolutely.
Right. You know, do your research, reach your own conclusions.
Yep. We're all adults here. We're all adults here. And if we don't want to do something, we shouldn't have to.
That's right. And, you know, being obviously the pastor in me was always would tell people, you know, this stuff leads to the mark of the beast. Don't let the government tell you what to do. It's your body. God gave it to you. So I'll jump on people with that. You have to decide. Don't let anybody decide for you.
That's right. That's right. And you know what I really felt bad for? Well, besides the hospital staff that were all forced, every hospital in this country said, if you're a nurse, you work in the hospital, you either take this vaccine or we're firing you. I mean, so many people lost their jobs, but also the poor military. I mean, these guys, they were forced to take this. And if you didn't, they kicked you out, but not nicely. I mean, this is horrible what they did to just the nurses and the doctors, but also our poor military guys who volunteered to help protect our country. And now you're forcing them to take something they don't think is safe, which turns out to not be exactly safe.
Well, I'll throw this little icing on the cake of what you're talking about. I happen to know, my wife knew a medical professional, and we're not going to say who, where, how. And she had a practice, and she gave someone the let's say the shot, you know, during the pandemic. I don't want to say which, you guys know what shot I'm talking about. She gave someone the shot because they requested it, and that person had a allergic reaction that put them in intensive care. It was that bad. from that so-called shot. And she had some people show up to her practice the next day from the government, and they threatened her and told her in her report she is to by no means mention that the allergic reaction she thinks came from what she administered, the thing that they were trying to push on everybody in the country.
Yes.
They threatened her and let her know she's better not put that in her report, or else they will make sure she loses her license.
I believe you. I 100% believe you.
I mean,
they lied to us about, oh, this is going to stop the spread. Remember, we were going to stop the spread. If everyone just gets vaccinated, then you won't get COVID. And then a couple weeks later, they realized that people were getting COVID even though they were vaccinated. So they said, okay, well, you can get COVID if you get the vaccine, but you won't go to the hospital and you won't die. And then they realized, oh, wait, people are getting the shot, they're getting COVID, and they're going to the hospital. What can we tell them now that will make them get this shot? I mean, like, they ran out of reasons for us to get this. So then they said, well, if you get the shot and you get it, then you won't be able to transmit it as easily. I mean, it was just like, they just keep making up all of these things, and none of it turned out to be true.
And I think that's the part where we just quickly tell everyone, for the next pandemic, you better know better.
Right.
Yeah.
You better use your brain. You better know better. So speaking of pandemics, do you guys see do you see something likely on the horizon, or like worse than what we just been through?
Well, you know, there are always new viruses or new strains of currently known viruses out there,
right,
that happen to be maybe more contagious or more virulent, more lethal to people. I mean, like this Chinese engineered new COVID that's in the news. I mean, supposedly in some lab in China, they have a COVID virus that they engineered specifically to hit with to infect humanized rats. Now, when I say humanized, that means that their DNA has been biologically changed to be more human.
right.
I have no idea if that changes anything else in them and their appearance. I don't think so, but they have some DNA that's in common with us. They call it humanized mice or humanized rats,
Right.
and it killed 100% of them.
Every single
one of them.
test
Right.
died.
Now, it hasn't gotten into the human population, but there are a lot of bad actors in the world today, and we can expect, I think, more outbreaks that essentially are man-made, like the current, like what I believe this
COVID.
the original
COVID was man-made for sure.
As time goes by, I'm really expecting more and more of that. And just in general, we have so many different viruses that have crossed the Atlantic from Asia and Africa and Europe. Just in the last few years, I mean, we had a gentleman show up with Ebola in 2014. It ended up in a Dallas hospital, infected 2 nurses. Zika virus crossed from French Polynesia into South America and caused a lot of damage there.
Bird flu. We had
bird flu, swine flu. I mean, every few years something's happening.
Measles. Someone that came into our country with measles that went through Dallas, and now there's some measles.
And some of these things are so contagious. I mean, if I placed you in a room with someone who had an active case of measles, let's say I put 10 people in that room, 9 out of those 10 people would get measles. Wow. Just by being in that room for an hour or 2.
It's very, very virulent, very, very highly transmissible. Highly transmissible.
Well,
so yeah. Oh, I was also going to say one thing about just this mutation is that, you know, we're seeing the COVID mutations. You know, you keep hearing the new COVID, and what's happening is when people get sick, your body tries to fight it, but the COVID virus, if it survives and it's transmitted to somebody else, learns. So this COVID virus changes every time it's in somebody and then goes to somebody else. So literally, if we all would have just, no matter what your job is, just stayed home and not moved, every single human on this earth for 2 weeks, nobody moved. Everyone shut the door and stayed in your house. We could have shut this thing down, because if it didn't jump to somebody else after that 2 weeks, it had nothing to live in. So it has to move and move. And every time it's in him, it changes a little. Whatever survives, if I get it, then now I've gotten a mutated virus from him, and then it mutates in me, and then it gets to you, and then it mutates in you, and you give it to your wife. And every time it does that, it's learning, it's learning, it's learning. So, you know, sadly, we're going to have this forever. And, you know, unfortunately, the one now that's out, and I don't even know if they have a name for it.
Jan 1.
I talked to our primary, my brother and his wife just got it, and they're in their 50s. They are so sick, so unbelievably sick, and
Right
they
now.
take vitamins, and they're healthy, and they're in their low 50s. They're not old or elderly or anything. My brother works out every day. They are coughing every 5 seconds, can hardly breathe. I've never seen those two so sick.
This variant is known as JN.1, and it's supposed to be more transmissible and somewhat more virulent, causes more hospitalizations, but so far not more deaths. So
Right.
Thank goodness.
Right. But
Wow. And this is the times we're living in. I mean, we know there's a lot of germ warfare. There's a lot of bad actors out there. There's some guy sitting in a laboratory somewhere who has an agenda, or he has a bunch of goons who have a
Right.
couple, you know, petri dishes, and they're getting to work splicing and dicing some of this stuff. So, you know, this is the type of stuff where it does make people think. When we see these movies and these scenarios, and we're talking about them, whether it's an EMP or a virus that just gets out of hand, and especially the virus you're talking about that China made, I did see that online, and the first thing I said is like, okay,
why?
why would you make something like that?
Right.
What good is that doing for human society?
Right.
You know, that's when it's just like, to me, it sounded like a veiled threat when China was like, oh, by the way, look what we made in our lab. You know, just thank God it's not getting loose right now, Mr. Biden.
Unreal.
You know?
Unreal.
It sounds like a threat. I mean,
Right.
Well,
Right.
they want to bring about the beginning of the Chinese century. We could say that the 20th century, you could easily say that was the American century. But, you know, right now, I'm not so sure that the 21st century can be called that. And I think that as things are going now, that I wouldn't be surprised if it ends up being in 2099. You'll say, well, that was the Chinese century.
Our great-grandchildren need to learn Mandarin Chinese, sadly.
Probably.
Yeah, I've been saying that to a few relatives. They're like, should I take Spanish as a second language? I'm like, if you could take Mandarin Chinese, I think you should learn that first, then Spanish.
Yes,
Because
talk to
that's
the
where
people. Yeah, you're right. Talk to the people who are coming in your neighborhood with the guns. You know.
Yeah, they're coming with they're financially, they're gonna have the upper hand on a lot of countries. So, you know, you might as well be able to speak the language, make yourself accessible where you can do something.
You're
Makes
right.
sense.
You're right.
I got another question here. Are there any old school recipes or treatments you recommend for sickness or illness? You know, from whether it's salt, chicken soup. I mean, because salt is one. I mean, I like to bring that one up because the Romans used to trade that stuff and use it. And you know, we see it in movies. I don't know. Was it Gladiator? Was that the one I'm trying to remember where somebody had a knife wound and Gladiator, they put maggots on the wound.
Yes.
Which, yeah, does that work?
Which, by the way, which not only does it work, but I actually
Yes.
tell you exactly how to use it, how to get the maggots, and how to use them on wounds in our survival medicine handbook.
That's in our book.
So
wow. Okay,
so
I'm reading it.
So one
It's in
thing
the
you
book.
can do. So one thing you can do now. The best fly to get the maggots from is the green bottle fly, and luckily the green bottle fly is all over the place in many parts of the country. And so what you do?
Oh, you're going to do that? You're going to describe this
I'll
now?
describe. Yeah.
Oh my gosh.
Basically, what you do is you get a bag, you get a plate or a bowl, and you poke holes in the bag and you kill something or get any piece of rotten meat. Put it in the bag with the holes in it. Just hang it up on a branch over which is hanging a bag that's hanging over the bowl. In 3 or 4 days, you're going to start having maggots because the flies will have crawled in through the holes in the bag, laid their eggs, and the maggots will start coming out of the holes in the bag and falling
And
into
falling
the bowl.
the bowl, the
So
empty
there's
bowl
there's
that's
your maggot.
waiting.
There's your maggots, and
Wow.
then you apply it. You apply the maggots, and the maggots eat the
Eat the dead flesh,
dead flesh.
so that the new flesh can grow. So they actually eat away the dead tissue because that's their meal, and then your new tissue can grow. So it
Wow. So
actually
that,
does work.
wow. Okay.
We
So
don't
that
need
moves.
to do that now because we have modern medicine, but yes.
But even in modern medicine, they actually do use the larva, the maggots, and for some of the healing processes.
Yeah, probably for some burns, I would think.
Wow. Okay. So
tissue.
I'm putting that in my preparedness box just in case.
Yes.
Like,
Another
okay.
great thing is raw unprocessed honey is fantastic for no expiration date. We were talking about expiration dates.
Yes.
Raw processed honey will last forever. You can pass it down generations. I mean, I bought a 5-gallon bucket. I'm like, I'm ready.
Me too.
It's great for open wounds. I mean, even like little cuts after you wash them up, instead of putting the antibiotic ointment, you can use raw honey. So that antibiotic ointment that we're talking about that has an expiration date that may lose effectiveness pretty quickly because it's in a gel or a cream, your raw and processed honey can replace that. So burns, even from the worst burn to minor burns, fantastic. Any kind of cuts, anything that's open, get raw honey in it, use that, cover that up with some gauze, and just keep adding honey to it. Really
Wow.
heals wounds. It's got a great low pH. It helps to stop bacteria growth. And then the consistency of honey is wonderful for healing wounds because wounds like to have a little bit of moisture. So the honey gives a perfect environment for the skin to heal. So it's really great for any time you have a cut. And this you guys can use now. It's not a problem. Oh, but don't put raw honey on children less than, I think, 2. Yeah, don't use that.
Okay. All right. That's good. You mentioned pH. What are your thoughts on, because I've heard this was done in World War II. I don't know if it's true. If you don't have like saline water for a drip, you could use coconut water. Is that true?
So you're talking about infusing into a vein. I would not do any of that. I would not make your own IV fluids. We have in the book a procedure, which is basically like a slow drip enema, and you can absorb fluids through your intestines, and it doesn't have to be sterile. If you're straight lining IV fluids that you've made and there's the slightest bit of bacteria in that, you can give somebody a horrible infection.
You've directly injected bacteria into their bloodstream.
Right.
And that can kill them.
But you can use clean water.
And what Amy's talking about is rectal rehydration.
Right. That's
and that is something used in World War I, actually.
Right. Way back in World War I.
Before they really had antibiotics in common use. I mean, antibiotics, IV hydration in common use.
Right.
They used to hydrate you through the rectum. And that's something that you can still do with just a few little items. I tell you exactly how to do it.
It's not hard. It doesn't require anything too fancy. Make sure if you're going to stock up, you buy an enema bag with the tube, because that's what you're going to use. And you're going to put a little clamp so it drips slowly. You're not running in fluids because there's only a certain amount that you could absorb per hour. So it's not fast, but you're going to be dripping this enema slow with a clamp so you control the tubing. But just buy an enema setup. And you can rehydrate somebody who's vomiting.
This is especially useful and also in people who are dehydrated, who are unconscious, that you can't give them oral rehydration. And the world has come, we're in a post-apocalyptic situation.
Right.
They're not making IV fluids. There are no IV fluids.
You don't
have to have some option to hydrate an unconscious person. Rectal rehydration is another option.
Right. Or maybe they're just vomiting, like your wife. Every time you gave her oral something, she vomited. There's that situation also with norovirus. Every time I drank something, I was throwing up. And if I couldn't go to the hospital and get IV fluids, this is what you can do.
Now, these are way out
This
of the
is
box
all
kind of stuff.
World War I techniques.
So
right?
sometimes the stuff that we talk about are downright obsolete methods from times past.
Right.
But you have to realize that in some of these situations, you're going to be thrown back medically to an earlier time. You know, we have but we do have knowledge. We have more knowledge of
Sanitation,
how to keep sanitation,
right.
how to try to prevent things
Foodborne
than we did
illnesses,
before.
but
Right.
how to properly cook food so that you don't
Right.
get sick.
Right. Exactly.
Right. Don't eat raw oysters or hot dogs at Times Square because that's where I got my norovirus. I made a mistake.
I don't know about Times
It
Square.
looked
these
good. It looked good. What can I say?
Well, you know, Times Square is it's a different place now.
Yes.
In fact,
yeah.
New York City is very different now. Very, very different. I'll just leave it at
Yes.
that.
Yes.
That's something. Yeah. Oh well.
I hear you.
Well, no, those what you said, the old techniques, some of the stuff that people may consider obsolete, that's the stuff we need to know some of this stuff because, you know, in case there's a serious crisis on the horizon, you know, we may need to resort to some of these things and say, hey, you know what, I knew this, or grandma used to do this, or whatever. Because what you guys just said about the animal, I'm still, my head is blown. I don't know if you saw the look on my face. I was like, the what? They used to do
Yep.
what?
Yeah.
You know, and I'm just
Yep.
like, man, you know, I could imagine trying to convince some guys, hey man, you need this if you can't drink the water, and some guys like, hey, now I'll die. You know.
Yeah, it's much safer than you know, people, we've gotten, you know, questions hundreds of times, you know, oh, I want to make these IV fluids. I'm like, no, you don't need to do that. We have something much safer, that you're not going to inject some fluid that you thought was completely sterile and it's not, into somebody's veins. Try this technique. You know, if you have to do something and you're in that situation, this is the safer option.
Now, I will say that this saline solution is not something you would want to inject, the homemade version.
No, never.
But it is very useful in open wounds to clean out
For
open wounds,
cleaning,
things like
yes.
that. And basically what you need is a pan with a lid. You need a liter of water, and you need 2 teaspoons of salt. You need to boil it for 10 minutes.
Right.
Let it with the top on, with the lid on. Let it cool, and then use it right away. And you have sterile saline solution for your
Cleaning wounds.
that are good. That's sterile enough to clean an open wound.
Right.
And so that's one thing that you don't have to buy these bottles of, you know, sterile saline solution that they have at the pharmacy, you know, to clean wounds, because you can make that on your own. So
Right.
there are things that you can do to make
and
on
you
your
can
own.
actually jar it and you can use
Wow.
it.
Yeah, and
over
it'll
the
stay
course,
good.
I think a week.
Stay good for a month.
A month in a mason jar that seals.
Mhm.
But once you open it, I think you need to use it within
Use
a week?
24 hours.
24 hours.
actually.
Okay. So you can make a bunch of like pint size mason jars with the salt water, normal saline it's called.
Right.
And then again, like I said, with open wounds, when you're changing the dressings, you want to use sterile gauze, but you also, to clean it twice a day or once a day, you need to use sterile solution. So the sterile normal saline is great because, again, you don't want to use dirty water, tap water, you know, to clean a wound initially. Or initially is okay, but with time, over time, as it's healing, you want to just keep that as clean as possible. So sterile solutions are best.
Wow. No, oh my gosh. You guys are just giving me, I like it when I'm getting overload, because now it's like when I have to tell my wife, I said, look, get a pen and paper, watch this thing, take notes, get their book
It'll be in the book.
It's all in the
It'll
book.
be in the
Oh,
book.
yeah.
The
It's all in the
Survival
book.
Medicine Handbook.
I'm like, honey, make sure we have the book, take notes, subsections, everything. I'm like, yo, my goodness. It's like this stuff we don't think about, but
Aw.
you know, in a disaster, you know, or emergency situation, this can save lives.
Yeah.
That's the truth.
That's the idea. I mean, we can't save every life. I mean, there's going to be, you know, in a situation where there's civil unrest, you know, a guy with a bullet in the head is going to die
Right.
in good times or bad times.
Right. And the
And,
hearts.
but there are deaths that are avoidable. There are sicknesses that are avoidable.
Yep.
And basically we're here to help you prevent
as
some of those.
many as possible.
Right, exactly.
Okay.
Oh, I
Go
wanted to
ahead.
just say the book. talking about the book and all of these things that, you know, where we say, you know, it tells you how to do this and it tells you how to do this. We did for this particular edition, the 4th edition, I did a color version. I did a private printing. It's an American printing company. And I gave them the file and they print it. And then I also forced them, because they didn't want to, make a spiral bound. So I made the book in spiral bound, which is an extra special thing that we've never done. And the front and back cover are double laminated, and you can leave it open, which has been something people have been requesting for 12 years,
Well,
you know, to have a book that lays open.
Because
so,
a lot of our stuff is step by step,
Yeah.
how to
right,
kind
like
of
a
stuff.
cookbook kind of thing. So the spiral bound is very nice because it stays open. But so I do have that version. And again, the American printer did it for me, and they hand bind this because it's so thick. It's almost 2 inches. They actually hand cut the holes and they put the spiral in by hand because it's too big for their machines,
Yeah.
apparently, which is why they didn't want to do it.
It's a big book.
And they charged me a fortune for it. But anyway, it's a handy thing, and it's an investment. I understand that, but we, you know, took a lot of time, and we have a lot of, I think, really good information in it. People would appreciate.
Wow. Well, you guys out there, I'm hoping everyone who's watching this, I'm hoping and believing you're going to get some of their material. You're gonna get their book. You can go on their website, www.doomandbloom.net. Go on their website directly if you just want to just go straight to the source. Cut out the middleman, go straight to the source. I believe in that, just going straight to the source. You know, I'm pretty, and I want to ask you guys this last question. You know, with all this stuff we talk about, it's, to some people it gets a little overwhelming. Some people have tougher skin, they can handle it like me, you know, but everyone's different. I respect that. Have you seen, like, in your career, have you seen any like modern day miracles where, you know, some people you could see that you didn't expect them to make it or survive, and they pulled through, they made it, you know? Have you seen anything like that? Because I just want to like encourage some of the folks watching this, because we all can pretty much sense that, you know, the United States is going to be going through some changes in the next few years, some serious changes. But I like to always leave people with that glimmer of hope, you know, just
Yep.
so they can at least think about it.
Pastor Keith, I think it happens all the time. I mean, I've seen people with cancer go into remission for no apparent reason
Right.
a number of times, and not just once. I mean, I have to believe there was some benevolent providence involved. I mean, I personally have operated on a few patients where a cancer was what I expected. I mean, I think the odds were 99% that it was a cancer. It turned out to be a benign tumor.
Right.
I mean, I consider that a miracle. And I once had a case of quintuplets that I delivered where 2 of them were thought to be stillborn. And sure enough, one of them came out alive and well. And so, I mean, it was quadruplets instead of quintuplets, essentially, because there was one baby that was dead. But they thought there were 2. And one of them did come out alive. And I just think that these things happen all the time. And I think that there's some greater hand in it than just what I can do with my hands, you know. And we have to believe that that there's a force there. And I'm a devout Christian, and I, you know, testify to it all the time.
Amen. Amen. Nurse Amy, do you have any? Because I know you, I saw you bubbling, but if you don't, it's okay too if you have a story.
No.
You don't have to. It's okay. I just like people just like to hear it. But you know, oh, I wanted to ask you this question, and this is before we sign off. I just wanted to ask this, just like in like survival situations, we have to respect that men and women are physiologically different. So my question for you, doctor, and as for you, Nurse Amy, what, in terms of preparedness wise, what do you think like women can do, specifically women can do, to prepare for, you know, worst case scenarios, or like, let's say 6 months the hospitals are closed or something like that, what can they do for the women in their family and their home in terms of preparing wise?
So I'm going to say that, you know, even if, let's say, you yourself have gone through menopause already and your girls are really young, or maybe you have grandchildren that are really young, prepare for menstruation. I know it's not an easy thing for men to talk about, but stock up on pads or whatever it is that, you know, you'd want to use. There are also reusable things, which I think are great for women now. They have these organic cotton pads that you can sterilize, almost like, you know, 100% cotton diapers. That's another thing that I would stock up on if I expected grandchildren, which I hope soon. You know, if I thought I was going to be anywhere near babies, you know, I would stock up on things that can be reused. So organic cotton pads to be reused, and also organic diapers. I would also be aware that some people might be having babies. So I actually put together an baby delivery kit, first aid kit, that you can buy on my store. It's store.doomandbloom.net. And that OB kit that you can use for delivering babies is actually the same equipment that I was using in the hospital that we would open up. I found the manufacturer, and I buy a lot of my medical supplies from them. And I got the same kit, and then I add all of the extra stuff that you would need, a measuring tape for the belly and nitrazine paper to see if their water is broken. So different things, you know, throughout the pregnancy and then delivery, for the baby and the mom. So an OB kit is something vital. Even if you yourself are not having babies anymore, perhaps you have neighbors or children or people around you that may be delivering babies, and the equipment can help you provide the care. Even if you don't do the delivery, you can give the kit to someone else who has the knowledge, who didn't prepare themselves, and then they can, you know, have a safer delivery for the baby and the infant, and hopefully, you know, bring them into the world as healthy as possible. So I would think about delivering babies too.
Awesome. Wow. Woo. Dr. Bones, do you have anything for geared to men in terms of preparedness before we sign off? Something like maybe the men or the little boys, whatever, you know, in terms of preparedness for, you know, a disaster type scenario or a long-term
Yeah,
period.
Brother Keith, I would say that I think all the men in the preparedness community have the beans and the bullets down pretty solidly, but I don't think they have the bandages down. And so I think that every man should, every prepper, but I think it would really benefit men to be able to figure out things like how to put together a survival sick room. Basically, how to put together a room in your house that you could quickly change into a room that you could take care of people who are either sick or injured. I think that's one thing that's important. I think that's important for men who can do the heavy lifting, to figure out ways to transport injured and sick individuals from one place to another. That's something that would be probably something that would happen from time to time, where your current location becomes too dangerous for you to be in. Let's say you need to get people moving one place to another. That's something else that they should be doing. And just in general, just think about medical preparedness. I mean, everybody's got this idea that, you know, the more bullets I get, you know, the better off I am. And you'll be able to make a lot more wounds, if you have more bullets. But, you know, if you don't have the bandages, you're not going to heal many wounds. And, you know, you're gonna wind up taking casualties, and those casualties, some of them, if you're not prepared and you don't have the medical down pat, you know, you're going to lose some of those people.
Because people got to prepare. A lot of people out here, they're preparing to send out the bullets. You may be the one to receive the bullet.
Yeah, right.
That's right. And that's basically our job, is to, you know, add that additional B to beans and bullets. It's beans, bullets, and band-aids.
Right.
Okay. Wow. Well, I'm blown away. This interview was awesome. I know we could probably go on for another hour, but I'm going to respect your time. I know you guys have things to do, and you're enjoying that beautiful weather down in somewhere.
Sunny South Florida.
Okay, I just paused it, so you said it. Okay, you're enjoying that beautiful weather, so I want you to go ahead and enjoy the weather. Thank you so much. I'm going to ask you, where can people find you on YouTube? Where can they find your books? Anything else that you have, material? You did mention the OBGYN stuff, so please just tell me where they can find your stuff as we close this.
So a simple way is, like you said, doomandbloom.net. At the top of that are all of our social media, our Facebook, our Instagram. You can find our podcast. You can listen to it there. It will connect you to all of the things. We do have a big Facebook group for survival medicine that has got really friendly people. They answer questions. Everybody talks to each other. There's a huge library file there with a lot of free information. So that's a great place to go. You can listen to our podcast, our YouTube channel, again, right at the top of doomandbloom.net. You can click on there. We have lots and lots of videos. We put out all of the information that we can on the website. We have over 1,500 articles, videos, podcasts, so he's a very good writer. He keeps up. A lot of the book information you can find on the website. The reason we've put the book together is so that you have a resource if you don't have internet. So we really just did the book out of, hey, we'll help you so you don't have to print out all of this stuff, and we'll organize it for you. So it really was just sort of a labor of love for people who were complaining back in 2012 about printing all of the articles and, hey, could you guys write a book? We had never thought about writing a book. So it was the folks who were using their printers and a lot of ink to print out all the articles that said, hey, can you guys just put this in a book for me? And we're like, oh, okay, I guess we can do that. Not realizing this is going to be years and years, but that's okay. We're happy to do it. We love it. So anyway, there is a store, again, the doomandbloom.net. You can connect. It'll say, shop our med kits. You click on that. Again, you can find huge medical kits, little bitty carry medical kits that can go in pockets, no matter what you're doing, traveling, end of the world, for your home, your kitchen, whatever you're doing. I have a kit for it. Teeth, eye, nose,
teeth,
baby. Yeah. Lots and lots of kits.
Well, okay, thank you so much. I mean, I like I said, I'm on brain overload tonight. You guys gave me a lot, and I know everybody who's watching, they're gonna be like, whoa, So I want to thank you. I want to thank you, Dr. Bones, Nurse Amy. I really, really appreciate your time. Thank you so much. Woo! I can't wait for us to do some lunch or dinner when I'm down in your neighborhood, which will be very soon, very shortly.
All right, let us know.
Absolutely.
I have plenty of family in your neighborhood, so I'll be seeing you very soon. I'll give you guys the heads up when I'm going to be around there. And for everybody out there in internet land who will be seeing this, please support doomandbloom.net. That's www.doomandbloom.net. Nurse Amy, Dr. Bones.
Okay.
Please support.
Wait, I like Dr. Amy. Maybe we should change that.
Dr.
Okay,
Amy,
yeah, we can. Hey,
okay.
I'll take the upgrade. No, you deserve
it. So please support my friends, support my people. These guys, they've been around for a long time in the preparedness community. They've been given a lot of good advice. They've been helping a lot of people out. They've really sewed into the lives of lots of people. And through them, I know a lot of people are going to save some lives because they've taught a lot of people some really good stuff, good information. And we learned a lot tonight here, guys. So again, I just want to thank you guys for just coming on the program. This was week 20 of my Patreon class, www.patreon.com/KeithIton Entertainment. And it is on YouTube, which the YouTube crowd is going to be watching this on KeithIton Entertainment. So thank you, everybody. I really thank you so much. And I want you guys to have a great year. It's the beginning of the year, so I'm really going to hope that you guys have a great year. God bless you, and God bless you. Thank you so much. I appreciate your time.
God bless you.
All right. Bye-bye.